Hello there, and welcome. Are you or someone you care about sometimes wondering if those little memory hiccups are just a normal part of getting older, or if they could be something more? Like when you walk into a room and forget why you went in there, or a name just slips your mind. It's a common concern, and you're not alone. Did you know that nearly 7 million Americans are living with Alzheimer's, the most common form of dementia? And that number is projected to grow. It's a big worry for many of us who want to stay sharp, independent, and fully engaged in life. But here's something important. What if I told you that not all memory changes are the same, and that some of the earliest signs of potential trouble are often missed or brushed off? And what if you knew there were powerful, everyday things you could do to give your brain the best possible chance to stay healthy? If you've ever thought, well, this is just what happens when you age, I'm here to tell you that significant cognitive decline doesn't have to be an inevitable part of your story. In the next few minutes, we're going to talk frankly about recognizing some of those subtle early signs of dementia. And then we'll count down 7 fantastic, science-backed strategies to help you boost your brain health starting today. The main goal of our chat today is to arm you with knowledge and empower you to take proactive steps for your brain. We'll first explore some of those early indicators that might signal something more than typical aging. Then we'll dive into our countdown of 7 key strategies for a healthier brain. And trust me, you'll want to stick around for strategy number 1. It's a real game changer for taking control. Much of the information we're sharing is supported by research from respected organizations like the Alzheimer's Association and the National Institute on Aging. Quick reminder, this video is for informational purposes only and does not constitute medical advice. Always consult with your personal physician or a qualified healthcare provider with any questions you may have regarding a medical condition or before making any changes to your health routine. All right, before we get to our brain-boosting strategies, let's talk about what to look out for. It's crucial to understand that dementia is more than just occasional forgetfulness. Dementia describes a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with daily life. It's not a specific disease itself, but Alzheimer's is the most common cause. So, what are some of those early signs that might be more than just a senior moment? First, memory loss that disrupts daily life. We all forget names or appointments sometimes, but then we remember them later. With early dementia, a person might forget recently learned information more often, ask the same questions over and over, or increasingly rely on memory aids or family members for things they used to handle themselves. For example, consistently forgetting important dates or events, not just needing a reminder now and then. Second, challenges in planning or solving problems. This isn't about making an occasional error when balancing a checkbook. It's more like having new trouble developing and following a plan, or difficulty concentrating and working with numbers, like following a familiar recipe or keeping track of monthly bills. Third, difficulty completing familiar tasks. This could be trouble driving to a familiar location, managing a budget at work, or remembering the rules of a favorite game. It's different from, say, needing help to use the settings on a new microwave. Fourth, confusion with time or place. People with early dementia can lose track of dates, seasons, and the passage of time. They may have trouble understanding something if it is not happening immediately, or they might forget where they are or how they got there. A typical age-related change is forgetting what day it is, but remembering it later. Fifth, trouble understanding visual images and spatial relationships. For some, vision problems are an early sign. This might include difficulty reading, judging distance, or determining color or contrast, which can cause problems with driving. This is different from vision changes due to something like cataracts. Sixth, new problems with words in speaking or writing. They might struggle to follow or join a conversation, stop in the middle of a sentence with no idea how to continue, or repeat themselves. They may struggle with vocabulary, have trouble finding the right word, or call things by the wrong name, like calling a watch a hand clock. This is more than sometimes having trouble finding the perfect word. Seventh, misplacing things and losing the ability to retrace steps. A person with dementia may put things in unusual places, like putting car keys in the refrigerator. They may lose things and be unable to go back over their steps to find them again. Sometimes they might even accuse others of stealing, especially as the condition progresses. This is different from misplacing your glasses or the remote control from time to time and being able to find them. Eighth, decreased or poor judgment. This might look like making bad decisions with money or paying less attention to personal grooming or keeping themselves clean. Everyone makes a questionable decision now and then, but this is a more consistent pattern. Ninth, withdrawal from work or social activities. A person with early dementia may start to remove themselves from hobbies, social engagements, or other activities they used to enjoy. They might have trouble keeping up with a favorite sports team or remembering how to complete a favorite hobby. This isn't the same as sometimes feeling weary of work or social obligations. And finally, 10th, changes in mood and personality. They can become confused, suspicious, depressed, fearful, or anxious. They may be easily upset at home, at work, with friends, or in places where they are out of their comfort zone. This is more pronounced than developing very specific ways of doing things and becoming irritable when a routine is disrupted. Recognizing these signs is the first step. If any of these sound familiar for yourself or a loved one, and they represent a change from usual behavior and are persistent, it's really important to talk to a doctor. We'll come back to this in our number 1 strategy. Okay, now that we have a better idea of what to look for, let's get into those empowering strategies to help keep your brain in top shape. We're counting down from 7. Coming in at number 7, let's talk about what's on your plate. It's no surprise that what you eat has a direct impact on your brain health. Think of your brain as a high-performance engine. It needs premium fuel to run smoothly. Diets rich in certain nutrients can help protect brain cells and reduce the risk of conditions that can affect your thinking, like high blood pressure and type 2 diabetes, both of which are risk factors for cognitive decline. Your action step here is to consider something like the MIND diet. Now, the name is a bit of a mouthful. It stands for Mediterranean-Intervention for Neurodegenerative Delay, but the principles are pretty simple and very effective. This diet emphasizes foods like leafy greens, think spinach and kale, aiming for at least 6 servings a week. It also includes other vegetables, at least 1 serving a day, nuts, about 5 servings a week, berries like blueberries and strawberries, 2 or more servings a week, beans, at least 3 to 4 servings or meals a week, whole grains, 3 or more servings a day, fish, at least once a week, and poultry like chicken or turkey twice a week. And try to use olive oil as your main cooking oil. Just as important is what the MIND diet suggests limiting: red meat, less than 4 servings a week, butter and stick margarine, less than a tablespoon a day, cheese, less than 1 serving a week, pastries and sweets, less than 5 servings a week, and fried or fast food, less than 1 serving a week. If you're planning on making big dietary changes or if you have existing health conditions, it's always a smart idea to have a chat with your doctor or a registered dietitian. Okay, Fueling your brain with good food is crucial. But what about keeping it active? That brings us to number 6. At number 6 is keeping your brain active and engaged. You've probably heard the phrase, use it or lose it. Well, that definitely applies to your mind. Learning new things and engaging in mentally stimulating activities helps build new connections between brain cells and can even help your brain become more adaptable and resilient. It's like building up a cognitive reserve, a backup power source for your brain. So what's your action step? Don't just stick to the same old crossword puzzle every day, though those are fine in moderation. The key is to try something new that really challenges you. Consider learning a new language or picking up a musical instrument. It's never too late. Take a class at a local community college or find one online. Play strategy games like chess, bridge, or even some of the more complex board games. Read books and magazines on diverse topics that pique your interest. Even simple things like trying to brush your teeth with your non-dominant hand can give your brain a little workout by forcing it out of its routine. This is generally safe and beneficial for everyone. But if you're concerned about sudden difficulties with learning or concentration that seem out of the ordinary, that's a good reason to consult your doctor. So we're feeding our brain and challenging it. Next up at number 5 is something that benefits both body and mind. Number 5 is all about getting physical. Regular exercise is truly one of the best things you can do for your brain. When you exercise, you increase blood flow to your brain, which delivers vital oxygen and nutrients. It can even help promote the growth of new brain cells and helps reduce the risk of conditions like heart disease, stroke, and diabetes, all of which are linked to cognitive decline. In fact, research highlighted by AARP and other institutions shows that physical activity can even increase the size of the hippocampus, which is the part of your brain heavily involved in verbal memory and learning. For your action step, the Centers for Disease Control and Prevention, CDC, recommends that older adults aim for at least 150 minutes of moderate-intensity aerobic activity per week. That breaks down to about 30 minutes, 5 days a week. Think of activities like brisk walking, swimming, cycling, or even vigorous gardening. Also, it's important to include muscle-strengthening activities at least 2 days a week. This could be lifting light weights, using resistance bands, or doing bodyweight exercises like chair squats. And don't forget balance exercises. Things like Tai Chi, yoga, or even simple exercises like standing on one foot can help improve your stability and prevent falls, which is crucial for maintaining independence. Interestingly, one study found that getting close to 9,800 steps a day was linked to a 50% lower risk of developing dementia. Of course, it's very important to check with your doctor before starting any new exercise program, especially if you have any chronic health conditions. If you're finding these tips helpful and getting some real value out of our chat today, do me a quick favor and hit that like button below. It really helps more folks find this information, and I truly appreciate it. All right, we've covered diet, mental challenges, and exercise. What's next? At number 4, it's about connection. Coming in at number 4 is the power of social connection. Staying engaged with others is incredibly important for brain health. Folks, social interaction stimulates your brain in unique ways, helps ward off stress and depression, and studies suggest it can even lower your risk of dementia. When you're talking, listening, sharing experiences, and engaging with others, you're giving your brain a good workout, flexing those cognitive muscles like memory, language, and problem-solving. Your action step here is to make a conscious effort to connect with friends, family, and your community regularly. Join a club that interests you, a book club, a gardening group, a walking group. Volunteer for a cause you care about. Take a group class at a local senior center or community college. Or even just organize a regular coffee date or dinner get-together with friends. If getting out and about is tough sometimes, don't underestimate the power of the good old telephone or learning to use video calls to stay in touch. The key is meaningful interaction and feeling connected. If you're feeling persistently isolated, lonely, or depressed, please don't hesitate to reach out to your doctor or a mental health professional. Social connection is vital. Now, for number 3, let's talk about something we all need, but maybe don't always prioritize enough. At number 3 is getting enough quality sleep. It's not a luxury, my friends. It's an absolute necessity for brain health. When you sleep, your brain is actually hard at work. It's clearing out toxins that build up during the day, some of which are linked to Alzheimer's. It's also consolidating memories, kind of like filing away the important information from your day and generally repairing itself. Think of it like your brain's nightly cleaning crew and essential maintenance team all rolled into one. And it's important to know that a consistent lack of good sleep is associated with an increased risk for dementia. So for your action step, most adults, including seniors, need around 7 to 9 hours of quality sleep per night. To help achieve that, try to stick to a regular sleep schedule, going to bed and waking up around the same time each day, even on weekends. Create a relaxing bedtime routine. Maybe read a book, take a warm bath, or listen to calming music. Make sure your bedroom is a sleep sanctuary, dark, quiet, and cool. And it's generally a good idea to avoid caffeine and heavy meals too close to bedtime. If you consistently have trouble sleeping, if you snore loudly, which could be a sign of sleep apnea, or if you feel excessively tired during the day despite spending enough time in bed, please talk to your doctor. Good sleep is a cornerstone of health. We're getting close to the top. Number 2 is about managing your overall well-being. Our number 2 strategy is a big one, and it really ties into many of the things we've already discussed. Manage your overall health, because what's good for your heart is very often good for your brain. Conditions like high blood pressure, high cholesterol, type 2 diabetes, and obesity can damage blood vessels throughout your body, including those that supply your brain with essential oxygen and nutrients. This damage can significantly increase the risk of cognitive decline and types of dementia like vascular dementia. It's also worth noting that research has linked other conditions like hearing loss and depression to an increased risk of dementia. Your action step here is to be proactive. Work closely with your doctor to manage any chronic health conditions you may have. Get regular checkups, take your medications as prescribed, and keep an eye on your numbers. That means your blood pressure, cholesterol levels, and blood sugar. If you've noticed changes in your hearing, get it checked out. Hearing aids can make a big difference. And please, pay attention to your mental health. Don't be afraid to seek help if you're struggling with stress, anxiety, or symptoms of depression. And of course, limiting alcohol consumption and not smoking are also key components of protecting both your heart and your brain. Regular checkups are absolutely key here. If you notice any new symptoms or if you're having trouble managing your existing conditions, don't hesitate to schedule a visit with your healthcare provider. And that brings us to our number 1 strategy, the one that really underpins all the others and empowers you to take charge. And here it is, our number 1 strategy. Be proactive about your brain health and don't hesitate to seek an early assessment if you have concerns. Many people delay talking to their doctor about memory or thinking concerns. Sometimes it's out of fear, or sometimes they dismiss their concerns, thinking it's just a normal part of aging. But an early and accurate diagnosis is so crucial. For one thing, some causes of cognitive symptoms are actually reversible. Things like vitamin B12 deficiency, thyroid problems, or even side effects from certain medications can mimic dementia symptoms, and these can often be treated. And even if the cause is dementia, like Alzheimer's disease, getting an early diagnosis allows you and your family to access treatments that can help manage symptoms, gives you more time to plan for the future, and allows you to be an active participant in decisions about your care and your life. It truly empowers you and your loved ones. So, what's the action step? If you or a loved one are experiencing persistent changes in memory, thinking, behavior, or mood that are concerning you or are starting to interfere with daily life, like the signs we talked about earlier, please schedule an appointment with your doctor. It can be helpful to write down your specific concerns and examples beforehand. And if possible, it's often a good idea to bring a trusted family member or friend along to the appointment for support and to share their observations as well. Your doctor can perform initial assessments, which might include cognitive tests and a review of your medical history, and may refer you to a specialist like a neurologist or a geriatrician if they feel it's needed. The time to talk to your doctor is when you first become concerned. Please don't wait until symptoms become severe. Early intervention can make a significant difference in managing the condition and maintaining quality of life. I'm really curious to hear from you. Which of these brain health strategies are you already practicing, or which one are you most inspired to try after our chat today? Let me know down in the comments section. Sharing your experiences can really help others in our community. So there you have it, a look at recognizing those early, sometimes subtle, signs of dementia, and, most importantly, 7 powerful strategies you can use starting today to support your brain health. Remember, while we can't control everything, like our age or our family history, there's so much we can do to nurture our minds and bodies. The key takeaway is this: small, consistent changes in your daily habits, what you eat, how you move, how you connect with others, how you sleep, how you manage your overall health, and how you challenge your mind, can lead to big results in your cognitive vitality and your overall quality of life. It's about being proactive, not perfect. It's about taking those positive steps, one day at a time. Thank you so much for joining me today. I hope you feel more informed, encouraged, and empowered. Your brain is an incredible asset. Let's keep it thriving. Don't forget to subscribe to the channel for more helpful content like this. And please share this video with a friend, a family member, or anyone you think could benefit from hearing this message. Here's to your vibrant health and a sharp mind for years to come. Take care.